Welcome back to Bay Sunday. The numbers are staggering. 55 million adults are currently taking care of their parents, with over 2 million caregivers. It's a generation that could use a helping hand, and our next guest is doing just that. She is the Chief Medical Director at Pathways, a Bay Area pioneer in home health care, hospice, and private care for nearly 40 years. Let's say hi to Dr. Ellen Brown. How are you, Doctor?
Very well.
Good to have you on board today. Well, tell us, what do you folks do?
So Pathways provides care to patients with hospice, home health, or attendant needs. We provide the highest quality of care. Hospice patients may only have 6 months or less to live. We provide support to them and their families because it's hard to be a caregiver.
And every patient is different, right? You go into homes, you give care, but you also assess what, Mr. Jones needs or Mrs. Jones, that kind of thing.
Yes, we provide something called patient-centered care. It's not a cookie-cutter approach. It really is finding out what's important to the patient. What's important to you, what are your values, what are your goals, and how can we assist you in helping you achieve those goals? Very individualized.
You got to get close to your patients. I was talking about my father who was on hospice, and to this day I'm still in touch with his home health care provider. And the hospice nurses that would come in kind of fell in love with my dad. It's not a depressing field, I guess is what I'm saying. You can actually get fulfillment in.
Very much so. I think everyone who works in hospice gets the question, oh, how can you do this?
I
It
know,
must be so
because you're
depressing.
taking care of a man that's passing away or a woman.
And many of us feel more blessed or better after going to see certain patients. I had one patient I can remember had a lot of wounds, needed a lot of wound care, and she would be giving away gifts and be full of gratitude for her life, and everyone left her home feeling better after that visit.
I know the nurses left my dad saying, we're supposed to be comforting him, and I'm sky high, It's kind of a neat thing. Home health, hospice, private duty care. What are the three kind of things that you folks do?
So hospice for people who their doctors think they have 6 months or less to live, providing them with care, helping them live well until they die. Home health for people who have a hard time getting out, require a skilled need, might be some nursing, wound care, physical therapy, usually after a hospital stay, with the goal is for them to regain their independence. Private duty is for attendant care. Someone needs a companion, help with medication, help with bathing, getting dressed, a companion. And then we also do geriatric care management, which is a service very often when there are family members, sons or daughters who live far away, geriatric care manager can help manage the care system, help get the person to their doctor's appointment.
Sure, you got to have that. And just the social care,
well,
because when you're cooped up in your home and, you don't have a long time to live, you need that social interaction.
Correct. And it's a team of people. It's doctors, nurses, social workers, chaplains, volunteers, home health aides, all coming out to provide physical care and social, emotional support and spiritual support.
So you might have a therapist go to some, you might have a nurse go to others. How do you know what kind of care?
So for hospice, a nurse is a case manager and a social worker are going out, assessing the patient, if patient needs spiritual support, home health aides, if they need help with, the nurse will decide if they need help with personal care. Doctors give orders for home health, usually asking for physical therapists and nurses. And then a nurse will also determine how much attendant care, what kind of services a person will need.
Who pays for it? Does insurance pick up hospice? How's that work?
It's a great question. Insurance definitely covers hospice. It's a Medicare covers it 100%, Medi-Cal covers it. Most private insurances have a hospice benefit. Home care also is covered by insurance, Medicare, if you meet the criteria for home health. Private duty is not covered by most insurances unless you have long-term care insurance.
How do you break the ice? You got a parent that is in failing health that needs hospice care. It's a tough question to ask.
It is a tough question, but such an important question. And more and more people want to have that conversation, but they don't know how to start it. And what I tell people is talk to your parent or talk to your spouse and find out what's important. How do you want to spend your days? What makes a good day for you? What are the trade-offs? What are you willing to put up with versus, maybe just I want to eat ice cream. As long as I can eat ice cream, I want to be alive.
Well, you do God's work. Thank you so much for coming in. We sure appreciate it.
Thank you, Frank.
Thank you, Doctor. For more information on Pathways, go to pathwayshealth.org. That's pathwayshealth.org. More Base Sunday right after the break, so stay right there, folks.